Thanks, Natasha, and let me begin by congratulating everyone who helped to make this report and this day possible. In particular, I want to congratulate RBM and Pat, Johns Hopkins, Tulane for producing really, I think in many ways, a historic report, but also, of course, all of the organizations that have helped to make these numbers possible. PMI, the Global Fund, World Bank, and so many others who have made these numbers a reality. The title of today's event is Counting Down to the Millennium Development Goals. And that's pretty accurate, because so much of the MDGs are really linked to the drive to end malaria deaths. 6 of the 8 MDGs for 2015 either partially or fully relate to healthcare. Malaria control is crucial to MDG 4, child mortality, MDG 5, maternal mortality, and of course 6, infectious diseases, including malaria. It also affects other MDGs. But of course those are just numbers and those are just titles. What's even more important than that is what it means for lives and fortunes all around the world. The real importance of these numbers is the progress of what fighting malaria will mean for humanity, for hopes, for dreams, for opportunities in places like sub-Saharan Africa. As Ambassador Ali has said very eloquently, malaria is a huge financial burden on Africa. Nearly 40% of her healthcare expenditures are due to malaria. Where progress is made in fighting malaria, money and beds and healthcare workers are freed up to take on other challenges. But it goes beyond saving healthcare resources. Studies show that scaling up malaria interventions would increase economic output in Africa by as much as $30 billion. So it's not complicated. When you conquer malaria, workers can work, students can study, governing leaders can invest more money in infrastructure and economic development. Africa as a whole rises. We at Malaria No More believe that this third report is very important because this new framework, the LiST model, as you have heard described, is more descriptive in laying out the cost-effectiveness of malaria interventions. Dr. Eisel laid it out very well. This report tells us that malaria prevention and treatment programs are not only saving lives, but in some ways you could argue that it's doing so at an accelerating rate. It tells us what we have achieved in human terms. About 485 children are now being saved each and every day in Africa. It tells us what we can achieve. Getting to universal coverage and extending it through 2015 will save an estimated 2.95 million African children. And just as poignantly, it reminds us of the consequences of losing our resolve, of not following through on our promises and pledges in the battle against malaria. As this report also concludes, an estimated 476,000 more children would die. And those of you who have traveled in Africa and have gone to the corners of sub-Saharan Africa, in quiet moments you'll hear healthcare leaders whisper. They wonder whether we'll follow through this time. They wonder whether we will keep our resolve. These are challenging fiscal times, and there are lots of worthy causes out there overseas, here at home. But the way I look at it, because every public dollar we spend is very, very precious, this is precisely the time to invest in causes like the battle against malaria. It's the time to have a robust pledge to the Global Fund and strong support for programs like PMI. The results of prevention and treatment programs are measurable, they're verifiable, and they are proven. This report suggests that these investments are saving lives. At least 485 children per day, freeing up vital healthcare resources, increasing economic output, and helping children to learn. Again, these are difficult times and there are lots of challenges out there. But we've come here in advance of the summit in New York because we think this study and others show that this is precisely the time to follow through and to make those pledges and to make those investments. Not only will it help us achieve historic progress on the MDGs as we began with, but it will do so much more for the future of Africa in the hopes of families all across that continent. Thank you, and again, my congratulations and gratitude to all those who are involved in this report and for hosting this event today.